Mr. Speaker, today I stand to update this honorable House and the public on the continued work to support and strengthen mental health in Bermuda. Mental health is not just a policy issue. It affects real people, families, and communities every day. Mr. Speaker, let me begin with a story. Picture a newborn entering the world already struggling, born into an unstable environment and facing addiction from the very start due to drug exposure during pregnancy. That child is placed into foster care, struggles with feeling unwanted, and grows up being told that you won't succeed because of your behavior. They face depression, low self-esteem, and self-doubt. This is not fiction. This is a real experience of a Bermudian who, through support and their own resilience, is now thriving. This story reminds us that mental health is personal. It lives among us, in our homes, our schools, our workplaces, and communities. It is real and it matters. The Ministry of Health remains committed to ensuring that every Bermudian has access to the mental health support they need. Mental well-being is an essential part of overall health, and we are embedding it into our primary care and public health strategies. Our goal is to act early, prevent crisis, and ensure support is available when people need it most. Mr. Speaker, one of our major steps forward is the implementation of the Youth Mental Health Plan. In partnership with the Bermuda College, under the leadership of Dr. Daniel Cavanaugh, a dynamic group of young leaders is driving this initiative. They are working to create a future where mental health is openly discussed, services are easy to access, and no young person feels alone. These young voices are shaping real change. They are helping to remove stigma and show that it is okay to talk about mental health. Their work is central to building a community that listens, supports, and empowers its young people. Mr. Speaker, we know the need is urgent. Research from the Pan American Health Organization and other groups shows a clear rise in stress, anxiety, and substance use. We know that the statistics confirm that 1 in 4 people will suffer from a mental health condition. Recognizing this, the ministry has taken action to improve services and our legislation. We are working to update the Mental Health Act of 1968 and strengthen policies that increase access to care and protect individual rights. We are building a system that meets people where they are before their mental health worsens. Mr. Speaker, one key part of this work is the Acute Adult Mental Health Care Integrated Pathway, which focuses on how adults with mental health needs receive care from start to finish. Phase 1 of this initiative was completed in 2023, and the final report was published in February 2024. It provided valuable insights into the challenges people face and gave us 20 key recommendations. These recommendations guide our investments in services, awareness, education, and early intervention. We are focused on building a system that is patient-centered, efficient, and compassionate. Mr. Speaker, to support these efforts, we've appointed a mental health programs coordinator who has already improved how programs are run and is working to make this role permanent. Strong leadership in this space is essential for long-term success. We also recognize the need to expand access to therapists, strengthen outreach, and provide better mental health support in our schools. Children and teens must have the tools to cope, grow, and succeed. Preventing crisis begins with giving young people early support. Mr. Speaker, this year we are proud to launch a national mental health awareness campaign under the theme, Changing the Paradigm, the Future of Mental Well-Being. It highlights that mental health is vital to our overall health and deserves the same attention and care. The campaign began on May 1st with a proclamation at City Hall marking May as Mental Health Anti-Stigma Month. And its tagline, Mr. Speaker, is "We are not an island." And that reminds us that while Bermuda may be geographically isolated, no one should feel isolated when facing mental health challenges. Throughout May, we held events to engage people of all ages, raising awareness, starting conversations, and helping everyone better understand mental health. These activities were developed in partnership with a range of community groups, service providers, schools, and health organizations. And we thank our partners such as the Bermuda College, the Bermuda Hospitals Board, the Family Center, Solstice, and many others for joining us in this shared mission. Mr. Speaker, our message is clear. There is no health without mental health. No one should be ashamed of seeking help. Getting help is a sign of strength, not weakness. We will continue to follow the guidance of our care pathways and youth plan to build a community where mental wellness is visible, valued, and supported. I strongly encourage everyone to be part of removing stigma in our community and making sure every person in Bermuda knows that they are not alone. Thank you, Mr. Speaker.